Hello and welcome to the topic Bone Tumors in the Rheumatology module. By the end of this topic, you should be able to define bone tumors, classify tumors based on their features, discuss the various types of bone tumors, and finally a brief discussion on investigation findings as well as the principles of management of bone tumors. Let's get started. Bone tumors form when bone cells divide uncontrollably, forming a mass or tumor. The tumor is considered benign if it is confined within its area and does not spread to the surrounding tissues. But if the tumor invades into the surrounding tissues or metastasizes through the blood or lymphatics, then it's considered malignant. Next, we'll be looking mainly at primary bone tumors, which are tumors that arise from bone cells. Bone tumors can largely be classified into benign and malignant. Examples of benign tumors are osteochondroma and giant cell tumor. Malignant bone tumors are osteosarcoma, Ewing sarcoma, and chondrosarcoma. Let's look at the most common type of benign bone tumor, which is osteochondroma, commonly occurring in males less than 25 years of age. Osteochondroma is thought to arise from the mutations of exostosis 1 and 2 genes, which encodes the exostosis proteins. These proteins help synthesize heparin sulfate, which is a protein that regulates the growth of the growth plate. When the tumor arises from the growth plate, it forms a stalk, what we call exostosis. Commonly affects distal femurs and proximal tibia. It can also occur over the ilium or scapula. Other types of benign tumor is giant cell tumor. The risk factors of developing these tumors are trauma to the bone and radiation exposure, and this type of tumor cells arise from osteoclast cells but then develop into cells with numerous nuclei. The giant cell tumor typically arises from the epiphyses of the long bone like the distal femur or proximal tibia. At times, this type of tumor can turn malignant, especially in elderlies. Next would be osteoid osteoma. This type of tumor arises from osteoblasts and forms a nidus which is less than 1.5 centimeters in size. A nidus is a disorganized mix of small blood vessels, trabecular, and unmineralized bone tissue called osteoid. The nidus is surrounded by a ring of sclerotic bone tissue. This type of tumor affects the tibia or long bone and does not erode the surrounding bone. Among malignant tumors, the most common one is osteosarcoma. Osteosarcomas arise from osteoblasts of different sizes called pleomorphic cells. An extensive osteoid tissue is formed by these cells. This type of tumor often forms at the metaphyseal regions of the long bone, commonly affecting adolescents. Mutations that are seen are p53 protein and PRB protein seen in retinoblastoma. Now the next would be malignant bone tumor Ewing sarcoma. This is common in adolescents 10 to 20 years. It's thought to arise from neuroectodermal cells. It looks like small round blue cells on microscopy. Chromosomal mutation, specifically translocation of the EWSR1 gene on chromosome 22, FL1 gene and chromosome 11. The outcome protein cause defect in differentiation in the cell causing Ewing sarcoma tumor cells, most commonly arising at the sacrum and the femur. Finally, we will be looking at chondrosarcoma. This tumor affects the elderly. It arises from chondrocytes, which are cells that produce cartilage. Chondrosarcoma mainly affects the bones of the pelvis and proximal femur and proximal humerus. On imaging, the tumor forms in the medullary cavity. Bone tumors cause fractures, swelling, and fever. Malignant bone tumors can cause fever due to chronic inflammatory response. Malignant tumors can also metastasize to the lungs, causing pulmonary symptoms. If the tumor impinges on spinal nerves, it can lead to numbness and limb weakness. If it impinges on a blood vessel, this can potentially lead to vascular necrosis. Medical imaging is very useful in the diagnosis of bone tumors. These are X-rays, CT scans, and MRI scan, or lab tests, which looks for serum tumor markers specific for each type of tumor that also can be done. To make it easy to remember, some tumors have classic X-ray findings, for example, osteochondroma causing exostosis, giant cell tumor forming multicystic bone lesions that look like soap bubbles, and osteosarcoma from lytic bone lesions referred to as sunburst appearance because the radiating tumor streaks look like sun rays. Osteosarcoma also causes the periosteum to lift, and this appearance is referred to as Codman's triangle. Treatment depends if the tumors are benign or malignant. Benign tumors can be removed surgically to reduce pain and to reduce risk of fractures. Meanwhile, malignant tumors are managed with radiotherapy, chemotherapy, and surgery, depending on the type and extent of spread of the tumor. This is an example of a summary for benign tumors. So they are osteoma, osteochondroma, and giant cell tumor, and these are the footnotes to be recalled and remembered. And lastly, malignant tumors, which are divided into osteosarcoma, Ewing sarcoma, and chondrosarcoma. We have come to the end of this topic. Thank you.